I want to get smarter on this and bring in the expert, former Acting CDC Director Dr. Richard Besser. He is also the president and CEO of the Robert Wood Johnson Foundation, which was founded with Johnson & Johnson stock, but it is independent from the company. Dr. Besser, what decision would you like to see on this J&J vaccine today?
Well, first, Stephanie, I think it was a really smart move to take a pause to assess whether there were more people out there who'd had this rare clot, and to let doctors know that this is a type of clot that isn't treated the way normal clots are done. Well, that's been done. They've done that assessment. And now I think is the time to say this vaccine should be available. But I think that in the interest of people making informed decisions, what the European Union did in terms of putting a label on there and saying there is a very rare risk of this clot, that would be a good thing to do. A question I would have is whether they have enough information to say the risk is only for women or the risk is only for people under a certain age. That's what I'll be looking to see, because the cases that have been reported out so far were only in women younger than 50. But there are a lot of people out there who don't like getting shots at all, and having the option of a vaccine that's a one and done situation is going to increase the vaccination rate for some people.
Sources have told Politico that the White House at this point has essentially written off the J&J shot because of all these issues. And basically they're hoping that maybe down the line they use it as a booster if they need it. What do you think about that?
Well, I think that the strategy from the White House was to stockpile or acquire as much vaccine as possible. And they've acquired more doses of vaccine than there are people in the United States. And what you're seeing in states around the country is that there's been such a ramp up of vaccination efforts with the Pfizer and the Moderna vaccines that most states are in a good position to be able to meet the vaccination needs that are out there. But I do think having a one-dose vaccine for harder to reach populations, maybe for more transient populations, is a tool that many states would still like to have.
Vaccine hesitancy is real. And it's not just, I'm not sure if I want to get it. There are an awful lot of people across this country who are absolutely no way, do not want to get this shot. What do we need to do to really address this at this point? It's not just about education. People are stuck in.
Yeah, I'm a general pediatrician, and this situation that we're facing now is something that I faced throughout my entire career. There are people, and it's the majority of people who want a vaccine, want it right away, know the value and the protection that's there. There are people that no matter what you say to them, they will not get a vaccine. They do not believe in it. That perspective is not based on facts and information and data. It's a heartfelt belief, and you're not going to get there with more information. But there is a large segment where if you take friction out of the system, you make it as easy as possible, you meet people where they are, you ask them truly what their concerns are, and you address those concerns, those people are movable. And what we're going to see is that the vaccination rates are going to continue to decline because all of that excess demand, all of those people who have just been dying to get a vaccine so they can get on with their lives, that demand is going to be met. And then it's going to be more meeting people slowly, getting vaccines into doctors' offices where many people are most comfortable getting their vaccinations, and slowly increasing the rate of people vaccinated across the country.
Well, then, as a pediatrician, what do we do about our kids? You wrote an op-ed this week specifically about children and the pandemic. And we know in the last week in the state of Michigan, 70 children were hospitalized with severe COVID symptoms. While we're still in this period where children cannot be vaccinated, how do we keep them protected?
Yeah, Stephanie, I see so many states declaring victory. that this is over, let's get on with it. And the reason Dr. Marita and I wrote that op-ed is that for children, it's not over. The first week in April, there were more than 70,000 cases in children. There have been several thousand cases of this very unusual inflammatory syndrome that's severe, and that's occurring in children. And when you look at who is being affected the most, the same distribution that we've been seeing in adults is in children. Black children, Latino children, Native American children have been hit the hardest. We won't have vaccines for all children until probably sometime this winter. Hopefully there'll be vaccines for children over 12 for school entry for this fall. But until we have that, all of these measures that we're being asked to do in terms of wearing masks and social distancing and hand washing, those things are going to help protect our kids. And so even if you're not concerned about your own health, and even though the risk of hospitalization and death in children is low, we don't know about long-term complications. And if we can save any children from having some of these rare conditions, why not do it? Why not step up and do our parts? That's what I'm concerned about right now.
We also need to be practical and realistic, especially for those who say they followed all the guidelines, they've been vaccinated, and now we're in this debate around wearing a mask outdoors, especially as we head into summer. Do we need to do it?
Well, I hope that the CDC steps up and gives people more things that they can do once they've been fully vaccinated. We knew last year, and we were recommending if you're outdoors in the open, 6 feet away from people, you don't need to wear masks. And I hope we get back to that, because as the weather is getting better and people are able to go outside, that freedom of just being able to walk around without a mask, in a park, in a place where you're not going to be very close to people, that's something that I would love to see us get back to.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.